Ladies, you're washing your vagina completely wrong, and I'll tell you exactly why. There's so much bad advice on the internet, and a lot of it is actually harming women over 60 without them even realizing it. Some of you are using fragrance soaps because you think you should smell a certain way. Others are scrubbing too hard or even rinsing inside because that's what a magazine or a friend once suggested. And I need you to know, as your doctor, that these habits can actually make things worse, leading to dryness, irritation, or even infections. Every woman deserves clear, honest information about how to wash safely. Because once you understand the difference between your vagina and your vulva, you'll see that one of them never needs washing at all and the other does, but only in a very specific way. I'm Dr. Leah Parker, and after more than 30 years of guiding women through every stage of life, I've learned that intimate hygiene is one of the most confusing topics of all. So today we're going to break down the myths, the do's and the don'ts. I'll share what I recommend in my own practice, the mistakes to avoid, and a simple hygiene routine you can trust every single day. And ladies, don't click away, because the last mistake we'll cover is the one I see most often in my postmenopausal patients, and it's the most damaging of all. So let's clear up the biggest confusion right away. Most women, when they say vagina, are actually talking about their vulva. And this is an important difference because it changes how you care for yourself. Your vagina is an internal organ. You can't see it from the outside. It's a muscular tube that connects your cervix, the neck of your womb, to the outside world. It's not meant to be scrubbed or rinsed. In fact, it has its own natural cleaning system. Now, your vulva is something entirely different. That's the part you can see on the outside. It includes the outer lips, which we call the labia majora, and the inner lips called the labia minora. It also includes your clitoris, the clitoral hood, and the pubic mound, that soft pad above the pubic bone where hair usually grows. All of that together is your vulva. I like to explain it this way. If your vulva is the frame, then your vagina is the picture inside the frame. The frame you can see, the picture is tucked behind it. And here's why that matters. The vagina cleans itself. It produces secretions, your normal discharge, that naturally flush out old cells and bacteria. It also maintains an acidic environment, which helps protect you from infections. That means you do not need to wash your vagina, ever. The vulva, on the other hand, does need gentle cleaning. Because it's exposed. It collects sweat, oil, and bacteria, just like the rest of your skin. If you don't clean it properly, you can get irritation, odors, or even infections. But the key is knowing how to do it safely, without stripping away your skin's natural balance. So to keep it simple, vagina stays untouched, vulva gets gentle care, and in the next part I'll show you exactly what that routine should look like. Many women are surprised when I tell them this, but your vagina is an organ that cleans itself. It doesn't need any help from you. The walls of the vagina produce secretions, what you know as discharge, and that fluid naturally carries away bacteria, old cells, and even traces of menstrual blood. On top of that, the vagina maintains an acidic pH, which creates an environment that protects against harmful bacteria and infections. It's an incredible design, and the truth is, trying to wash inside only disrupts this balance. Things like douching or even just rinsing with water can remove the good bacteria your body relies on, leaving you more vulnerable to irritation and infections. The vulva, on the other hand, is exposed. It's on the outside, and like any other skin surface, it collects sweat, oil, and bacteria. The groin has sweat glands that can create odor, especially since that area is usually covered with clothing all day. Menstrual blood, urine, and even semen can leave residue on the vulva as well. And because the vulva also has folds of skin, the outer and inner lips, these areas can trap moisture and bacteria if they aren't gently cleaned. So here's the bottom line. Your vagina is self-cleaning and should be left alone. Your vulva is not self-cleaning, and that's the part that benefits from regular gentle washing. And now that we've cleared up that difference, let's move on. In the next part, I'll walk you step by step through how to wash your vulva safely, the right way, the mistakes to avoid, and the little changes that make a big difference after 60. Now let's talk about how to actually wash your vulva the right way. This is the part most women have never been taught, and it's also where I see the most mistakes. Start with warm water. Not hot, because hot water strips away the natural oils from your skin, which can leave the vulva dry and irritated. Warm, gentle water is all you need to begin. Next, use a mild, unscented cleanser or soap. Fragranced products may smell nice, but they often lead to irritation, especially for women after 60, when the skin is already more delicate. I know some of you may be thinking, but doctor, I've used scented soaps for years and never had a problem. And that may be true, but the risk of irritation increases with age, and it's always safer to choose unscented. Think of it as protecting the balance your body has worked so hard to maintain. Use your hand to apply the cleanser rather than a washcloth or sponge. Your hands are gentler, and cloths can hold bacteria unless you wash them very regularly. If you struggle with ingrown hairs in the pubic area, a soft cloth can sometimes help, but for most women, clean hands are best. When you wash, focus only on the outside. That means the pubic mound where hair grows, the outer lips, and the inner lip. Gently separate the folds and wash both sides. You can also clean around the clitoris and clitoral hood, but do this softly. There's no need for vigorous scrubbing. And remember, never put soap inside the vagina. The vagina is self-cleaning, and soap inside can do real harm by upsetting your natural bacteria and pH. Once you've washed, rinse thoroughly with warm water, making sure no soap is left behind. Then gently pat the area dry with a clean towel. Don't rub, the skin there is thin and delicate, and rubbing can cause irritation. And as a small but important reminder, make sure your towels are washed regularly. That's the basic routine. Simple, gentle, and effective. And for some women, especially those with dryness or irritation, an unscented moisturizer or barrier ointment can be helpful after washing. But that's something to use only if you feel you need it, not every single time. And here's one more tip that often gets overlooked. Always put on clean underwear after washing. Even new underwear should be washed before wearing, because you don't know where it's been before it reached your drawer. Now that we've gone through the right way to wash your vulva, I want to spend some time on the mistakes that can quietly undo all of your good intentions. These are the things I see again and again, and they're more common than you might think. The first is douching. Some women still believe they need to rinse inside the vagina to stay fresh. But remember what we've said, the vagina cleans itself. When you douche, you flush out the good bacteria that protect you, and you raise your risk of infections like bacterial vaginosis. In fact, studies have even linked regular douching with higher rates of pelvic infections and pregnancy complications. So please, don't do it. The second mistake is relying on fragranced wipes or feminine sprays. I know they promise a sense of cleanliness, but what they actually deliver is irritation. The skin on the vulva is delicate, and fragrance is one of the most common causes of contact allergies. If you do use wipes occasionally, maybe when traveling, make sure they're unscented, and think of them as a backup, not a daily routine. The third mistake is long soaks in the bath instead of proper washing. A bath can feel relaxing, but just sitting in water doesn't really clean the folds of the vulva. You need gentle, direct washing with your hand and cleanser, not just soak. And another one I want to mention is deodorants. I can't tell you how many women have told me they've used vaginal deodorants because they felt embarrassed about their natural scent. Ladies, your vagina and vulva are not supposed to smell like flowers. They have a natural scent that is normal and healthy. Using deodorants doesn't make you cleaner, it only increases the risk of irritation, and even worse, it can cover up a smell that might actually be your body's way of telling you something is wrong. If you notice a strong, unusual odor, that's a reason to see your doctor, not a reason to mask it. The last mistake is about the shower head. Some women ask me if letting water spray directly at the vulva counts as douching. The answer is no, as long as the spray is gentle and only on the outside. But avoid using a high-pressure stream directly inside, because that can cause irritation, and in some rare cases, even small injuries. So when we put this together, the rules are simple: no douching, no deodorants, no fragranced wipes, no scrubbing, no high-pressure water jets. Gentle, simple, consistent care is all your vulva needs. And now in our final part, I want to share when it's important to go see a doctor, because sometimes, what seems like just a hygiene issue is actually your body asking for medical attention. Before we finish, I want to talk about something just as important as how to wash: when it's time to see your doctor, because sometimes what feels like a simple hygiene concern is really your body trying to tell you something. If you notice persistent dryness, itching, or irritation that doesn't get better with gentle washing, that's worth getting checked. If your discharge changes, whether it's the smell, the color, or the amount, that's another sign. If sex becomes painful, if you feel burning when you pass urine, or if you see blisters, sores, lumps, or warts on the vulva, please don't ignore it. And if you ever have bleeding after menopause, that's something we always want to look into right away. I know many women hesitate because they feel embarrassed, or they worry about wasting the doctor's time. But please hear me on this, it is never a waste of time to care for your health. Most of the time, these concerns turn out to be treatable, and the earlier you come, the easier it usually is. So let's put it all together. The vagina is self-cleaning, leave it alone. The vulva needs gentle daily care with warm water and unscented cleanser. Skip the deodorants, skip the douching, and keep things simple. Your body knows how to take care of itself, and your job is just to support that balance. If this conversation helped you, I'd love to invite you to subscribe, because every week I share gentle advice like this for women navigating life after 60. And I'd love to hear from you in the comments. Did anything in this video surprise you, or have you been doing things differently until now? Share your experience, we learn so much from one another. Ladies, we deserve clarity, comfort, and confidence in every stage of life. And that starts with caring for ourselves, in the way our bodies were designed to be cared for.